You are about to take amlodipine, or maybe you've been taking it for months or even years, and like most people, you probably think you understand what it does. Lower your blood pressure, relax your blood vessels, keep your heart safe, and all of that is true. But here is what almost no one tells you before you take amlodipine, and what I have learned after years as a cardiologist, watching patients struggle with symptoms they never expected, stop their medication without telling their doctor, and in some cases, put themselves at unnecessary risk, simply because no one explained the full picture. Before you take amlodipine, there is something you need to understand. Not to scare you, not to make you stop, but to help you stay on it safely, comfortably, and effectively for as long as you need it. Because amlodipine is one of the most commonly prescribed blood pressure medications in the world, especially for people over 60. And it works. It truly does. But it also comes with a set of effects that are rarely discussed in the few minutes you spend with your doctor. And those effects, when they appear, often lead people to make exactly the wrong decision. I have seen it so many times. A patient comes in, frustrated. Their ankles have been swelling. They feel more tired than usual. Or maybe their gums feel tender or different. And no one told them this could happen. So they assume something is wrong. They assume the medication is hurting them. And sometimes, without any conversation, they simply stop taking it. That is dangerous. Stopping amlodipine abruptly can cause your blood pressure to rise quickly, sometimes higher than before you started, and that rebound can put you at risk for serious problems. So before you take amlodipine, or before you decide to stop it, let me walk you through what you actually need to know. Not the leaflet that comes in the box, not the rushed summary from a pharmacy counter, but a real, thoughtful explanation from a cardiologist who wants you to feel informed, not afraid. Let me start with a question. When your doctor first prescribed amlodipine, did they explain what a calcium channel blocker actually does inside your body? Most people hear the name and it sounds technical, maybe even intimidating, but the basic idea is surprisingly simple. Your blood vessels are surrounded by tiny muscles. Those muscles contract and relax to control your blood pressure. When they contract too much, your blood vessels become narrower and your blood pressure goes up. Amlodipine works by blocking calcium from entering those muscle cells, and without that calcium, the muscles relax. Your blood vessels widen, blood flows more easily, and your blood pressure comes down. That is the part everyone knows. The part no one talks about is what happens when those same relaxed blood vessels start to change how fluid moves in your body, because that is where most of the surprising effects come from. And that is why, before you take amlodipine, you need to understand the difference between a side effect that is harmless and a side effect that requires attention. Here is what I want you to hold in your mind as we go through this together. Amlodipine is not a bad medication. It is actually an excellent medication. It has saved countless lives. It prevents strokes, heart attacks, and kidney damage. But like any tool, it works best when you understand how to use it. And the most common reason people stop taking amlodipine is not because it stops working. It is because they experience something unexpected, they feel worried, and no one reassures them. So before you take amlodipine, or before you let frustration build up over time, let me give you the calm, complete picture. I am going to share with you what I tell my own patients, not what sells a product, not what fits into a 5-minute appointment, but what actually helps people stay healthy, stay informed, and stay in control of their own heart health. Think about the last time you picked up a prescription. You probably got a bag, a bottle, and a folded piece of paper with tiny print. That paper lists every possible reaction anyone has ever reported, and that is important for legal reasons, but it is not helpful for understanding what you are likely to feel, what you can do about it, and when you actually need to call your doctor. That is what I want to give you today. Before you take amlodipine, I want you to understand 3 things. First, most of the common effects people worry about are not dangerous. They are uncomfortable sometimes, yes, but they are manageable. Second, there are simple, practical strategies that can reduce or eliminate those effects without stopping the medication. And third, The real danger is not the medication itself. The real danger is stopping it suddenly without medical guidance. I remember a patient. Let me call him Richard. Richard was 72, retired, active, and his blood pressure had been creeping up over the years. His doctor started him on amlodipine. Within a few weeks, Richard noticed his ankles were swelling by the end of the day. He did not tell his doctor. He just stopped taking the pills. 2 weeks later, he woke up with a terrible headache and a blood pressure reading that scared him. When he finally came to see me, he said, "I thought I was protecting myself." And I understood why he thought that, but he was wrong. And he was not wrong because he was careless. He was wrong because no one had explained to him before he took amlodipine that ankle swelling is actually expected, that it happens because of how the medication works, and that there are ways to manage it. So before you take amlodipine, or if you have already started and you are wondering what to do, let me invite you to stay with me for the rest of this video. I am going to explain not just what happens, but why it happens, and more importantly, what you can do about it. No fear, no exaggeration, just clear, calm medical insight that helps you make better decisions for your long-term health. Because here is the truth. High blood pressure is called the silent killer for a reason. It does not hurt. It does not warn you. It just quietly damages your blood vessels, your heart, your kidneys, and your brain over years. Amlodipine is one of the most effective tools we have to stop that damage. But it only works if you take it consistently. And you will only take it consistently if you understand it. So let me help you understand it. Before you take amlodipine, or before you decide to stop, let me give you the conversation you should have had with your doctor. Let us begin with the overlooked problem, the thing most people get wrong, and the reason so many seniors end up confused about a medication that could actually help them live longer, healthier lives. Here is the overlooked problem. The thing most people get wrong about amlodipine, and the reason so many seniors end up confused, frustrated, or even afraid of a medication that could actually help them. Most people believe that if a medication is working the way it should, you should not feel anything at all. You take the pill, your blood pressure goes down, and life continues exactly as before. That is a reasonable expectation. In fact, that is how many blood pressure medications work. But amlodipine is different, and that difference is almost never explained before you take it. Here is what happens. Because amlodipine works by relaxing your blood vessels, and because it stays in your body for a very long time, it creates a set of physical effects that are not signs of something going wrong. They are signs of something going right, but they feel wrong. And that disconnect between what you expect and what you experience is where the problem begins. Let me be very specific. When amlodipine relaxes your blood vessels, it does not just lower your blood pressure. It also changes how fluid moves between your bloodstream and your tissues. Normally, your blood vessels have a certain amount of tone, a gentle squeeze that helps push fluid back toward your heart. When that squeeze relaxes, fluid can leak out into the surrounding tissues more easily, and gravity does the rest. That is why the most common effect people notice is swelling in the ankles and feet. By the end of the day, after you have been upright, fluid has slowly moved downward, and because your vessels are more relaxed than usual, that fluid settles in your lower legs. Now, if no one explained this to you before you took amlodipine, what would you think when you looked down and saw puffy ankles? You might think the medication is hurting your kidneys. You might think your heart is getting weaker. You might think you are retaining fluid because something dangerous is happening. And those are reasonable concerns. But in the vast majority of cases, that swelling is not a sign of organ failure. It is not a sign of heart failure. It is simply a mechanical effect of how amlodipine works. I have had patients come to my office truly frightened because their shoes felt tight by evening. They had already convinced themselves that their heart was giving out, and when I examined them, their heart was fine. Their kidneys were fine. Their lungs were clear. The swelling was isolated to their ankles. It was soft and pitting, meaning you could press a finger into it and leave a temporary dent, and it always improved after they slept with their legs elevated. That is classic amlodipine edema, and it is almost never dangerous. But try telling that to someone who was never warned. Try telling that to someone who thought they were taking a medication to protect their heart, only to feel like their body was falling apart. This is the overlooked problem, not the medication itself, but the gap between what doctors know and what patients are told. In a typical 15-minute appointment, a doctor has to review your history, check your blood pressure, adjust your medications, and answer your questions. There is rarely time for a deep explanation of pharmacology. So you get a prescription. You get a standard warning about dizziness or flushing, and you are sent on your way. Then you go home, you start the medication, and a few weeks later, something changes. Your ankles swell. You feel more tired than usual. Maybe your gums feel tender, or you notice they are growing slightly over your teeth. And because no one told you this could happen, you assume the worst. Let me pause here and say something important. None of this is your fault. And none of this means your doctor is bad at their job. The reality is that our healthcare system is not designed for long, thoughtful conversations about every possible effect of every medication. It is designed for efficiency. And that efficiency comes at a cost. The cost is that millions of people stop taking their medications every year because they experience something unexpected and no one reassures them. I have seen the data. Studies show that within 1 year of starting a new blood pressure medication, nearly half of all patients stop taking it. Half. And the most common reason is not cost. It is not forgetfulness. It is side effects. But here is what those studies also show. When patients receive clear, calm, thorough explanations before they start a medication, they are far more likely to continue taking it. Not because the side effects disappear, but because they understand what is happening. They know what to expect. They know what is normal and what is not. And that knowledge changes everything. So before you take amlodipine, or before you decide that the swelling or the fatigue or the gum tenderness is too much to handle, let me reframe how you think about these effects. They are not punishments. They are not signs that your body is rejecting the medication. They are simply the predictable results of a drug that works by relaxing your blood vessels. And once you understand that, you can stop worrying and start managing. Here is another piece of the overlooked problem. Many people assume that if a medication causes any discomfort at all, it must be doing more harm than good. But that is not how medicine works. Every effective medication has trade-offs. Statins can cause muscle aches. Beta blockers can cause fatigue, ACE inhibitors can cause a dry cough, and amlodipine can cause ankle swelling and gum changes. These are not signs that the medication is failing. They are signs that the medication is working exactly as designed. The question is not whether you experience them. The question is whether you have a plan to manage them. And that is where most people get stuck, because no one gives them a plan. No one says, if your ankles swell, here is what you can do. No one says, if you feel more tired, here is how to adjust your daily routine. No one says, if your gums change, here is why it happens, and here is what your dentist can do. You are handed a prescription and expected to figure out the rest on your own. And that is not fair. That is not good medicine. And it is certainly not the way to help people stay healthy as they age. So let me give you the plan. But first, let me tell you about another patient. Her name was Margaret. Margaret was 68, a retired school teacher, and she had been on amlodipine for about 3 months. When she came to see me, she had already made up her mind. She wanted to stop. Her ankles were so swollen by the end of the day that she could not wear her normal shoes. She felt tired in the afternoons in a way she never had before, and she was convinced that the medication was slowly breaking down her body. I listened to her. I examined her. And then I asked her one question. Did anyone explain to you before you took amlodipine that this swelling might happen? She looked at me and said, No. No one told me anything. I just picked up the prescription and started taking it. And when my ankles swelled, I thought my heart was failing. That broke my heart a little, because Margaret was not wrong to be concerned. She was just uninformed, and being uninformed led her to fear. and fear led her to want to stop a medication that was actually protecting her. Her blood pressure had gone from 160/95 to 130/80. That is a significant improvement. That improvement was reducing her risk of stroke, heart attack, and kidney disease. But all she could see was the swelling. All she could feel was the fatigue, and no one had given her the tools to understand that those things were manageable. So I sat with Margaret. I explained exactly what I am explaining to you now. I told her that the swelling was not her heart failing. It was fluid settling in her lower legs because her blood vessels were more relaxed. I told her that elevating her legs for 20 minutes in the afternoon, wearing compression socks, and reducing her salt intake could make a noticeable difference. I told her that the fatigue often improves after the first few months as the body adjusts. And I told her that if the swelling became too uncomfortable, we had options. We could lower the dose. We could add a second medication that counteracts the swelling. We could switch to a different class of blood pressure medication altogether. Margaret looked at me and said, "Why did no one tell me this before?" And I did not have a good answer. Because the truth is, she should have been told. Before she took amlodipine, someone should have sat with her for 10 minutes and explained what to expect. That 10 minutes would have saved her 3 months of worry. It would have saved her from feeling like her body was betraying her. And it would have kept her from almost stopping a medication that was helping her. This is the overlooked problem in a nutshell. Not a problem with the drug, a problem with the conversation. And that is what I am trying to give you today. The conversation you should have had before you took amlodipine. The conversation that answers your real questions, not the textbook answers, the human answers. What will I feel? Is it normal? What can I do about it? And when should I actually be worried? So before we move on to the real-world pattern and the patient stories that illustrate exactly how this plays out, let me leave you with this thought. If you are taking amlodipine and you have noticed changes in your body, do not assume the worst. Do not assume you have to stop. And please, do not stop without talking to your doctor. What you are experiencing is likely predictable, manageable, and not dangerous. But you need the right information to know that. And that is exactly what we are going to build together in the rest of this video. Let me tell you about someone. Not a real patient, of course, but someone who represents the kind of story I have seen unfold in my clinic more times than I can count. Let us call him Frank. Frank is 65 years old. He retired last year after 37 years as a high school history teacher. He loves gardening, walking his dog, and spending time with his grandchildren. He does not smoke, he barely drinks, and he has always thought of himself as someone who takes care of his health. But about 8 months ago, Frank went to his primary care doctor for a routine checkup. His blood pressure was 155/92, higher than it had ever been. His doctor talked to him about lifestyle changes, eating less salt, moving more, managing stress. And then his doctor also recommended medication. Amlodipine, 5 milligrams once a day. Frank trusted his doctor. He filled the prescription. He took the first pill that evening. And for the first few weeks, he did not notice much of anything. Maybe a little flushing in his face here and there. Maybe a mild headache that went away with water. Nothing serious. He thought, okay, this is fine. I can do this. Then, around week 4, something changed. Frank started noticing that his ankles felt tight by the end of the day. Not painful exactly, but puffy. His shoes, which had always fit comfortably, suddenly felt snug in the evenings. He would take off his socks and see indentations around his ankles. He pushed on the swollen skin with his thumb and watched a dent linger for a few seconds before slowly filling back in. Frank did not know what to make of this. He had never had swelling before. His mind, like most minds, went to the worst possible place. Maybe his heart was weakening. Maybe his kidneys were failing. Maybe the medication was damaging him in ways he could not see. He did not call his doctor. He did not want to seem like he was complaining. He just worried, quietly, every day. By week 8, the swelling was worse. Frank stopped going on his afternoon walks because his feet felt heavy. He started sitting in his recliner for most of the evening with his feet flat on the floor, which, as you will learn in a moment, is exactly the wrong thing to do. He felt tired. Not the normal tired of a busy day, but a bone-deep fatigue that made him want to nap in the afternoon, something he had never done before. And he started to wonder if the medication was worth it. Then Frank made a decision I have seen hundreds of patients make. Without calling his doctor, without asking any questions, without giving his body the chance to adjust, he stopped taking amlodipine. Cold turkey. He just did not refill the prescription. And for about a week, he felt great. The swelling went away, his energy came back. He thought, see, I was right. My body was telling me something. That medication was bad for me. But here is what Frank did not know. And here is what I need you to understand. When you stop amlodipine suddenly, your blood pressure does not just go back to where it was. It can rebound even higher. Because your body has adjusted to the medication. Your blood vessels have become accustomed to being relaxed. When you remove the medication abruptly, those same blood vessels can constrict more forcefully than before. It is called rebound hypertension, and it is dangerous. 2 weeks after Frank stopped his medication, he woke up in the middle of the night with a crushing headache. He felt dizzy. His vision was blurry. His wife took his blood pressure. It was 180/110. They went to the emergency room, and after several hours of testing and treatment, Frank was told that he had experienced a hypertensive crisis. He had not had a stroke, thank goodness, but he had come dangerously close. His blood pressure had been high enough to damage his blood vessels, his kidneys, and his brain if it had continued much longer. When I met Frank in follow-up, he was confused. He said to me, "Dr. Narges, I stopped the medication because I was trying to protect myself. The swelling felt wrong. The fatigue felt wrong. I thought I was listening to my body." And I looked at Frank and I understood. Because Frank was not wrong to pay attention to his body. That is actually a good thing. What Frank was missing was context. He had no framework for understanding what he was feeling. He had no one to tell him that the swelling, while uncomfortable, was not a sign of heart failure. He had no one to tell him that the fatigue often improves with time. He had no one to tell him that there were solutions, simple solutions, that could have kept him on the medication safely and comfortably. And because no one told him, he made a decision that almost cost him dearly. Frank is not unusual. In fact, Frank is the rule, not the exception. I cannot tell you how many patients I have seen who stopped their blood pressure medication because of side effects that were never explained to them. Swelling, fatigue, dizziness, flushing, gum tenderness. These are not rare. They are common. They are expected, and they are almost always manageable. But without someone explaining that, without someone saying, "Here is what you will feel, and here is what you can do about it," people default to fear, and fear leads to stopping, and stopping leads to strokes, heart attacks, and emergency room visits. So let me give you the context that Frank never got. Let me walk you through what actually happens in the body when you take amlodipine. Not in a complicated textbook way, but in a way that helps you understand why you feel what you feel. Because once you understand the why, the fear starts to dissolve. And once the fear dissolves, you can make clear, calm, informed decisions about your health. Think about your blood vessels as a network of flexible tubes. They have muscles in their walls that can squeeze tight or relax open. When those muscles squeeze tight, your blood pressure goes up. When they relax open, your blood pressure goes down. Amlodipine works by keeping those muscles relaxed. That is its job. That is why your blood pressure improves. But here is the part that matters for how you feel. Those relaxed blood vessels are also more leaky, just a little bit. Not leaky in a dangerous way. Leaky in a way that allows small amounts of fluid to move from your bloodstream into the surrounding tissues. And because gravity exists, That fluid settles in the lowest part of your body, your ankles and feet. This is why the swelling is worse at the end of the day. You have been upright. Gravity has been pulling fluid downward all day, and your relaxed blood vessels have allowed more of that fluid to escape into your tissues. When you lie down to sleep, your legs are level with your heart. Gravity stops pulling. The fluid slowly re-enters your bloodstream, and you wake up with normal ankles. That pattern, swelling that appears during the day and resolves overnight, is a hallmark of amlodipine edema, and it is almost never dangerous. Now let us talk about fatigue. Why does amlodipine make some people feel tired? The answer is related but slightly different. When your blood vessels relax, your blood pressure drops. That is the goal. But your body has to work to adjust to that new, lower pressure. Your heart rate may increase slightly. Your body releases certain hormones to maintain adequate blood flow to your brain. This adjustment period takes time. For some people, a few weeks. For others, a few months. During that adjustment, you may feel more tired than usual. Not because the medication is damaging your energy, but because your body is adapting to a new normal. And for most people, that fatigue gradually lifts as their body learns to operate efficiently at the lower blood pressure. The gum changes are another story entirely. Amlodipine can cause overgrowth of gum tissue. It is not common, but it happens. The medication affects the way your gum cells grow and repair themselves. They can become swollen, tender, and prone to bleeding. They can even start to grow over your teeth. This is not dangerous, but it is uncomfortable, and it is often reversible. Your dentist can help. Good oral hygiene, more frequent cleanings, and in some cases, a different medication can resolve the issue completely. The point I want you to take away from Frank's story is this. Frank was not wrong to notice changes in his body. He was not weak or overly anxious. He was human, and humans need information to make good decisions. Frank did not have that information, so he made a decision based on fear instead of facts, and that decision put him in the emergency room. You do not have to repeat Frank's mistake. You are here. You are watching this video. You are seeking understanding, and that already puts you in a much stronger position. Before you take amlodipine, or if you have already started and you are wondering what to do, let me give you the 3 key insights that most people miss. Insights that would have saved Frank months of worry and a trip to the hospital. Insights that will help you manage the effects of this medication without fear, without stopping, and without putting yourself at risk. Now let us go deeper. Let us move beyond the surface level of what you feel and into the actual mechanism. The hidden chain of events that starts the moment you swallow that tiny pill and continues through every system in your body. Because once you understand the mechanism, the fear dissolves. And when the fear dissolves, you stop guessing and start knowing. Amlodipine belongs to a class of medications called dihydropyridine calcium channel blockers. That is a mouthful. But all it really means is that amlodipine targets a specific door on the surface of your vascular muscle cells. That door is called a calcium channel. Under normal conditions, calcium flows through that door into the muscle cell, and that inflow of calcium acts like a key turning a lock. It triggers the muscle to contract. When the muscle contracts, your blood vessel narrows. When your blood vessel narrows, your blood pressure goes up. Now here is where amlodipine does its work. Amlodipine slips into that calcium channel and blocks the door. It prevents calcium from entering the muscle cell. Without calcium, the key cannot turn. The lock stays open, the muscle cannot contract, so it relaxes. When the muscle relaxes, your blood vessel widens. When your blood vessel widens, your blood pressure goes down. That is the core mechanism. Simple, elegant, effective. But here is what most people do not realize. That relaxation does not happen evenly everywhere in your body, and it does not happen at the same speed everywhere. Amlodipine has a particular preference for your arteries, the vessels that carry blood away from your heart, rather than your veins, the vessels that carry blood back to your heart. And that preference matters enormously for how you feel. Your arteries are thick, muscular, and designed to handle high pressure. When amlodipine relaxes your arteries, blood flows more easily from your heart to your organs. That is wonderful for your blood pressure. Your veins, on the other hand, are thinner, less muscular, and designed to hold a large volume of blood. Amlodipine does not relax your veins nearly as much. So you end up with a situation where the arteries are wide open, letting blood flow in easily, but the veins are relatively unchanged, creating a bottleneck for blood returning to the heart. This imbalance creates pressure. Not dangerous pressure, but mechanical pressure. Blood flows into your lower legs through wide open arteries. It pools in the small vessels of your feet and ankles, and then it struggles to flow back up through veins that have not relaxed as much. Over the course of the day, as gravity pulls down and the venous bottleneck holds blood back, fluid gets pushed out of your capillaries into the surrounding tissue. That fluid is called interstitial fluid. And that buildup of interstitial fluid is what you see and feel as swelling. This is why the swelling is worse at the end of the day. You have been upright for hours. Gravity has been working against venous return. Fluid has been slowly accumulating, and because your arteries are relaxed and your veins are not, that fluid has nowhere to go but out into your tissues. Then you lie down to sleep. Your legs are now level with your heart. Gravity is no longer pulling fluid downward. Your kidneys, which have been working all day, finally get a chance to process that extra fluid. You urinate more at night, and you wake up with normal ankles. That pattern, swelling that appears during the day and resolves overnight, is the signature of amlodipine edema, and it is almost never a sign of heart failure. In heart failure, the swelling does not go away overnight. It persists. It gets worse over time. It is accompanied by shortness of breath, especially when lying flat, and crackling sounds in the lungs. Amlodipine edema is different. It is mechanical, it is positional, and it is predictable. Now let me explain the fatigue, because that is another mechanism that confuses people. When amlodipine relaxes your arteries, your blood pressure drops. That is the goal. But your body has a built-in system for maintaining blood flow to your brain. It is called autoregulation. Your brain is extremely sensitive to changes in blood pressure. It needs a steady, reliable supply of oxygenated blood at all times. When your blood pressure drops, your brain sends signals to your heart to beat faster, and to your blood vessels to constrict slightly, just enough to maintain flow. This adjustment takes energy, it takes work. And that work is happening constantly in the background, every second of every day. For the first few weeks or months on amlodipine, your body is essentially running a constant background process of recalibration. It is learning a new normal. And that background process can feel like fatigue, not the sharp fatigue of illness, but a dull, heavy, low-energy feeling that makes you want to rest more than usual. Here is what I want you to understand about this fatigue. It is not a sign that the medication is damaging you. It is a sign that your body is adapting. And for most people, as the weeks go by, the nervous system learns to regulate blood pressure more efficiently at the new lower level. The background process becomes automatic and invisible. The fatigue lifts. You wake up one day and realize you have not felt tired in weeks. That is the adjustment completing. But there is another layer to the fatigue mechanism. Amlodipine can also affect something called baroreceptor sensitivity. Baroreceptors are tiny pressure sensors located in your carotid arteries and your aorta. They constantly monitor your blood pressure and send signals to your brain. When your blood pressure drops, your baroreceptors tell your brain to activate your sympathetic nervous system, your fight or flight response, to bring it back up. That activation can cause a mild, persistent state of heightened alertness mixed with exhaustion. It is like your body is gently revving its engine all the time, and that revving is tiring. Again, this is not dangerous. It is not harmful. It is simply your body doing what it evolved to do, maintaining stability in a changing environment. And over time, your baroreceptors recalibrate. They learn that the new lower blood pressure is actually the new normal. They stop sending alarm signals. The sympathetic nervous system calms down, and the fatigue resolves. Now let me address the gum changes, because that mechanism is completely different and often surprises people. Amlodipine affects not just muscle cells, but also cells called fibroblasts. Fibroblasts are the cells that produce collagen and other structural proteins in your connective tissue. In your gums, fibroblasts help maintain the shape and health of your gum tissue. Amlodipine can cause these fibroblasts to become overactive. They start producing more collagen than usual. That extra collagen causes your gums to thicken, swell, and sometimes grow over your teeth. This process is slow. It happens over months, not days. It is more common in people who already have some gum disease or poor oral hygiene, and it is usually reversible. When you stop the medication, the fibroblasts calm down. The extra collagen gradually breaks down. Your gums return to normal. But here is the important point. You do not have to stop the medication to manage this. Your dentist can help. More frequent cleanings, better brushing and flossing, and in some cases, a prescription mouthwash can keep your gums healthy while you continue taking amlodipine. If the overgrowth becomes severe, your doctor can switch you to a different blood pressure medication that does not affect fibroblasts the same way. I want to pause here and make something very clear. None of these mechanisms, the swelling, the fatigue, the gum changes, none of them mean that amlodipine is a bad medication. They mean that amlodipine is a potent medication, and every potent medication has effects that go beyond its primary intended action. The question is not whether those effects exist. The question is whether you understand them, whether you can manage them, and whether the benefits of the medication outweigh the inconveniences. For the vast majority of people over 60 with high blood pressure, the benefits of amlodipine are enormous. Lower blood pressure means lower risk of stroke, lower risk of heart attack, lower risk of kidney failure, lower risk of dementia. Those are not small things. Those are the difference between living independently into your 80s and needing full-time care. Those are the difference between watching your grandchildren grow up and missing their lives entirely. So when you feel that swelling in your ankles, or that fatigue in the afternoon, or that tenderness in your gums, I want you to remember the mechanism. I want you to remember that these are not signs of failure. They are signs of a medication doing exactly what it was designed to do, with some predictable side effects that you can manage. And I want you to remember that stopping the medication suddenly, without a plan, without a conversation with your doctor, is far more dangerous than any of these effects. You have options. You have strategies. You have a path forward that does not involve fear or suffering or emergency room visits. And that path begins with understanding. Now that you know the mechanism, let me give you the 3 key insights most people miss. Insights that will help you take control of your experience with amlodipine, manage the effects, and stay on the medication safely and comfortably for as long as you need it. Now we arrive at the heart of what you came here for. The 3 key insights most people miss. Not medical jargon, not textbook definitions, but real, practical, usable knowledge that you can apply starting today. Knowledge that would have saved Frank from his hypertensive crisis. Knowledge that would have saved Margaret from months of unnecessary worry. Knowledge that will help you stay on amlodipine safely, comfortably, and effectively. Let me share these insights with you one by one. And as I do, I want you to think about your own body. Think about what you have noticed since starting amlodipine. Or if you have not started yet, think about what you will watch for. Because these insights are not abstract. They are deeply personal. They apply directly to your daily life. Insight number 1. The timing of your dose matters more than you think, and most people get it wrong. Here is what I see all the time. A patient is prescribed amlodipine. The bottle says take once daily, so they take it in the morning with their other medications. They swallow the pill with breakfast and go about their day. And then they wonder why they feel dizzy or tired in the afternoon, or why their ankles swell more on some days than others. The truth is that amlodipine has a very long half-life. That is a fancy way of saying it stays in your body for a long time. The half-life of amlodipine is about 30 to 50 hours. That means if you take a 5 milligram pill today, half of it will still be in your body 2 days from now. This is actually one of the reasons doctors like amlodipine. If you miss a dose, your blood pressure does not spike immediately. You have a cushion. But this long half-life also means that the medication builds up in your system over time. It takes about 7 to 10 days to reach what we call steady state, the point where the amount going in equals the amount going out. So what does this have to do with timing? Everything. Because the peak concentration of amlodipine in your blood occurs about 6 to 12 hours after you take it. If you take it in the morning, the peak hits in the afternoon or early evening. That is when you are most likely to feel the effects. The vasodilation, the potential dizziness, the fatigue. And if you are active during those hours, standing, walking, being upright, that is also when the swelling will be most noticeable. But here is the insight that most people miss. You can work with this timing instead of fighting it. If you take your amlodipine at night, before bed, the peak concentration occurs while you are sleeping. You are lying down. Your legs are elevated. Your body is at rest. The dizziness and fatigue happen while you are already asleep. The swelling never has a chance to build up because you are not upright during the peak hours. Many patients find that simply switching from morning to evening dosing dramatically reduces their side effects. The swelling improves, the fatigue improves, and they wake up feeling better than they did before. Now, I want to be clear, this is not medical advice for you personally. You should always talk to your doctor before changing when you take your medication. But this is absolutely a conversation worth having. Ask your doctor, would taking amlodipine at night help reduce my side effects? For many people, the answer is yes, and it is such a simple change. No new prescription, no additional cost, just a different time of day. That is the power of understanding the mechanism. You stop being a passive recipient of medication and start being an active partner in your own care. Insight number 2. The swelling in your ankles is manageable without stopping the medication, and there are 3 simple strategies that work for most people. Let me be direct about this. Ankle swelling is the #1 reason people stop taking amlodipine. I have seen it over and over. The swelling starts. It is uncomfortable. It is scary. And no one tells you what to do. So you stop. And then your blood pressure goes up. And you are back where you started, but worse, because now you have missed weeks or months of protection. So let me give you the strategies that I give my own patients. 3 simple, evidence-based approaches that reduce or eliminate amlodipine-induced edema without stopping the medication. Strategy 1. Elevate your legs. Not for 5 minutes, not occasionally, but systematically. Twice a day, for 20 to 30 minutes, lie down and put your legs up so your feet are above the level of your heart. Use pillows. Use the arm of your sofa. Use a recliner that actually tips you back. The goal is to use gravity in reverse, to help that pooled fluid drain back into your bloodstream. Do this once in the afternoon and once in the evening. You will be amazed at how much difference it makes. Strategy 2. Reduce your salt intake. I know you have heard this before, but let me explain why it matters specifically for amlodipine edema. Salt attracts water. The more salt you eat, the more fluid your body holds onto. That fluid has to go somewhere, and if your blood vessels are already relaxed and leaky, that extra fluid will go straight to your ankles. You do not need to eliminate salt completely, but if you can reduce your daily sodium intake by just 1,000 milligrams, about half a teaspoon of salt, you will hold on to significantly less fluid. The swelling will decrease, your blood pressure will improve even further, and you will feel lighter and less puffy overall. Strategy 3. Wear compression socks. Not the tight, uncomfortable ones you might be imagining. Modern compression socks are comfortable, breathable, and come in different levels of pressure. For amlodipine edema, a mild to moderate compression, around 15 to 20 millimeters of mercury, is usually enough. These socks gently squeeze your lower legs, helping push fluid back up toward your heart. They are especially effective if you put them on in the morning before the swelling starts. Wear them during the day, take them off at night, and let your legs rest. Many of my patients tell me that compression socks made the single biggest difference in their comfort level. Now, if these strategies are not enough, there are medical options. Your doctor can add a second medication, such as an ACE inhibitor or an angiotensin receptor blocker, that counteracts the swelling mechanism. These medications dilate your veins, not just your arteries, balancing the pressure and reducing fluid leakage. Or your doctor can lower your amlodipine dose and add a different blood pressure medication to make up the difference. Or your doctor can switch you to a different calcium channel blocker, like felodipine or nifedipine, which may cause less swelling for some people. The point is that you have options, many options. Stopping the medication is not your only choice. In fact, it is your last choice. So before you give up on amlodipine, try the strategies. Have the conversation with your doctor. Explore the alternatives. You will almost certainly find a solution that works for you. Insight number 3. The fatigue is temporary for most people, but there is a specific pattern you need to recognize. I mentioned earlier that the fatigue from amlodipine is usually an adaptation phenomenon. Your body is learning to operate at a lower blood pressure. That takes time. For most people, the fatigue improves significantly within the first 4 to 8 weeks. For some, it takes 3 to 4 months. But for almost everyone, it does improve. The key is to recognize what is happening and not panic. However, there is a second type of fatigue that some people experience, and this one is different. This fatigue is not about adaptation. It is about dose. Some people are simply more sensitive to amlodipine than others. Their blood pressure drops too much. Not to dangerous levels, but enough to cause persistent, ongoing fatigue that does not improve with time. If you have been on amlodipine for 3 months and you are still exhausted, still struggling to get through the day, still feeling like you are moving through molasses, that is not adaptation. That is a sign that your dose may be too high for your body. Here is what you need to know. The standard starting dose of amlodipine is 5 milligrams, but many people, especially older adults, especially those who are smaller or more sensitive to medications, do better on 2.5 milligrams. That is half of a 5 milligram pill. Your doctor can prescribe that lower dose, and for many people, that lower dose is enough to control their blood pressure while eliminating the fatigue. If 2.5 milligrams is not enough, your doctor can add a small dose of a different medication, like lisinopril or losartan, to reach your target blood pressure without pushing the amlodipine dose higher than your body can tolerate. The mistake I see so often is that patients assume the dose they were given is the dose they have to take. That is not true. Medicine is not one size fits all. The goal is to find the lowest effective dose that controls your blood pressure with the fewest side effects. That might be 5 milligrams for some people. It might be 2.5 for others. It might be 10 milligrams combined with another medication for someone else. You and your doctor should work together to find your sweet spot. Let me add one more layer to this insight. The fatigue from amlodipine can also be worse if you are dehydrated. When you are dehydrated, your blood volume is lower. Your blood pressure naturally drops. Add amlodipine on top of that, and your blood pressure can drop even further, causing more fatigue. So drink water. Not gallons, but enough to keep your urine pale yellow. Hydration helps your body maintain stable blood pressure and reduces the medication-induced fatigue. And here is something else. The fatigue can be worse if you are also taking other medications that lower blood pressure. Beta blockers, alpha blockers, diuretics, other calcium channel blockers. If you are on multiple blood pressure medications, the combined effect can be substantial. Your doctor should review your entire medication list regularly to make sure you are not taking more than you need. Sometimes the fatigue is not from amlodipine alone. It is from the combination. And simplifying your regimen can make all the difference. So let me summarize these 3 insights before we move to our final reflection. Insight 1. Timing matters. Taking amlodipine at night can reduce side effects for many people. Insight 2. Swelling is manageable. Elevate your legs, reduce your salt, wear compression socks, and talk to your doctor about medical options before you stop. Insight 3. Fatigue is usually temporary, but if it persists, your dose may be too high. A lower dose or a different combination could solve the problem. These insights are not complicated. They do not require expensive equipment or special training. They simply require that you know them. And now you do. You are no longer the patient who is handed a prescription and sent home with no explanation. You are informed. You are empowered. You are ready to have a better conversation with your doctor. And that brings us to our final section, a calm reflection on what all of this means for your long-term health, your peace of mind, and your ability to age well. Because amlodipine is just one piece of a much larger picture, and I want to help you see that picture clearly. Let us take a step back now, a deep, calm breath, because we have covered a lot of ground together, and I want you to feel settled, not overwhelmed. You have learned about the mechanism of amlodipine, how it relaxes your arteries, lowers your blood pressure, and why that leads to the effects you might be feeling. You have heard about Frank and Margaret, people just like you who faced confusion and fear because no one explained what to expect. You have discovered the 3 key insights that most people miss: the timing of your dose, the management of swelling, and the truth about fatigue. And now, in this final part, I want to help you put all of this into perspective. Because here is the deeper truth. Amlodipine is not your enemy. High blood pressure is. And high blood pressure is silent, patient, and relentless. It does not announce itself with swelling or fatigue. It does not give you visible signs that something is wrong. It simply works, year after year, damaging the delicate inner lining of your blood vessels. That damage leads to tiny tears and scars. Those scars attract cholesterol and inflammatory cells. Over time, those deposits grow into plaque. And that plaque narrows your arteries, stiffens your vessels, and sets the stage for a heart attack or a stroke. The first sign of high blood pressure is often a catastrophe, a sudden loss of speech, a weakness on one side of the body, a crushing chest pain that drops you to your knees, or worse, nothing at all. Just a silent progression until one day your heart gives out or your brain bleeds. That is the reality of untreated hypertension, and that is why medications like amlodipine matter so much. When you take amlodipine, you are not just swallowing a pill. You are making a choice to protect your blood vessels, a choice to reduce your risk of disability, a choice to be there for your family, your grandchildren, your friends, for years longer than you would have been otherwise. That is the big picture. And the swelling in your ankles, the fatigue in your afternoons, the tenderness in your gums, those are small prices to pay for that kind of protection. But only if you know how to manage them. And now you do. Let me share something with you that I wish every patient could understand. The human body is remarkably adaptable. It can learn to function well at a wide range of blood pressures. But that adaptation takes time. It takes patience, and it takes the right information. When you start amlodipine, you are asking your body to change a fundamental operating parameter. Your blood pressure has been a certain way for years, maybe decades. Your blood vessels, your heart, your kidneys, your brain, they have all adapted to that pressure. When you lower it, even for the best of reasons, your body needs time to recalibrate. During that recalibration, you may feel things. Dizziness when you stand up too quickly, fatigue in the middle of the day, a sense that your body is working a little harder than usual. These feelings are not signs of harm. They are signs of change. And change, even positive change, can be uncomfortable. The key is to recognize that this discomfort is temporary. It is a bridge you cross on your way to better health. And on the other side of that bridge is a body that has learned to thrive at a lower blood pressure, with more flexible blood vessels, less strain on your heart, and a dramatically reduced risk of the disasters that high blood pressure can cause. I want to give you a practical takeaway, a simple set of actions you can take starting tomorrow. Not a complicated plan, but a calm, thoughtful approach to managing your health. First, if you are already taking amlodipine, do not stop. Not without talking to your doctor. If you are experiencing side effects that bother you, call your doctor tomorrow. Say these words: I am taking amlodipine and I am having side effects. Can we talk about adjusting the timing, the dose, or adding another medication to help? Those words will open a conversation that could lead to a simple solution, a conversation that could keep you protected without suffering. Second, if you have not started amlodipine yet, but your doctor has recommended it, have this conversation before you fill the prescription. Ask your doctor, what side effects should I expect? What should I do if my ankles swell? What should I do if I feel tired? Is it better to take this in the morning or at night? Those questions will signal to your doctor that you are an engaged, informed patient, and that engagement will lead to better care. Third, and this is important, monitor your blood pressure at home. Not obsessively, not multiple times a day, but regularly. Take it at the same time each morning, after you have emptied your bladder, but before you have eaten or taken your medication. Sit quietly for 5 minutes. Keep your feet flat on the floor. Rest your arm at heart level. Write down the numbers. Bring that log to your doctor. Home blood pressure monitoring is one of the most powerful tools you have for understanding how your medication is working. It removes the guesswork. It gives you data. And data leads to better decisions. Fourth, pay attention to your body, but do not let fear drive your decisions. The swelling is usually manageable. The fatigue usually passes. The gum changes can be treated. These are not emergencies. They are inconveniences. And inconveniences can be solved. The real emergency is stopping your medication and letting your blood pressure spike. That is what leads to strokes. That is what leads to heart attacks. That is what leads to the hospital bed and the long recovery and the loss of independence. So when you feel frustrated, remind yourself of the alternative. Remind yourself why you started this medication in the first place. Fifth, and this is my final piece of advice, build a team. You do not have to navigate this alone. Your doctor is your partner. Your pharmacist is your resource. Your dentist can help with gum changes. And your own curiosity, your own willingness to learn, is your greatest asset. You have already demonstrated that curiosity by watching this video. You have already taken a step that most people never take. You have sought understanding. And that understanding will serve you well, not just with amlodipine, but with every health decision you face in the years ahead. Let me leave you with a reframe, a way of thinking about amlodipine that shifts the emotional weight. Instead of seeing it as a burden, see it as a tool. Instead of resenting the side effects, see them as signals that the tool is working. Instead of fearing your body's reactions, see them as opportunities to learn and adjust. This is not about blind acceptance of medication. It is about informed partnership with your own health. You are not a passive recipient of medical care. You are an active participant. And active participants get better outcomes. I have spent my career as a cardiologist watching patients struggle with exactly the confusion and fear we have discussed today. And I have also watched patients transform once they understood. Once they knew why their ankles swelled, they stopped worrying. Once they knew how to manage the fatigue, they stopped suffering. Once they knew they had options, they stopped stopping. And their blood pressure improved. Their risk dropped. Their lives got longer and healthier. That is what I want for you. So here is my calm, confident perspective. Amlodipine is a good medication. It is not a perfect medication. No medication is perfect, but it is good. And with the knowledge you now have, it can be good for you. The swelling can be managed, the fatigue can be minimized, the gum changes can be treated, and the protection against stroke, against heart attack, against the silent damage of high blood pressure, that protection remains, day after day, year after year. Before you take amlodipine, or if you have already taken it and wondered whether to continue, remember this video. Remember Frank and Margaret. Remember the mechanism. Remember the 3 insights. And remember that you have a partner in your doctor and a partner in yourself. You are not alone. You are informed. You are capable. And you are making a choice for your long-term health, one thoughtful decision at a time. Thank you for spending this time with me. If you found this helpful, I invite you to subscribe to Healthwise with Dr. Narges Every week, I share calm, credible, evidence-based insights on heart health, longevity, and the everyday decisions that shape how we age. No fear, no hype, just thoughtful medical understanding to help you live better, longer. Take care of yourself. And as always, talk to your doctor before making any changes to your medications. I will see you in the next video.